Hi, this is Dr. Doug Willen, and this video is specifically about Addison's disease, or also known as adrenal insufficiency. Now, if you've seen any of my previous videos where I compare adrenal fatigue to adrenal insufficiency, you'll see the difference. But I think a good comparison would be that a lot of people have gluten intolerance, but not everybody has the disease called celiac disease. So a lot of people have the symptoms, the milder version of the symptoms that wreak havoc on their lives, called adrenal fatigue, where they feel overwhelmed and their bodies aren't able to catch up and recover and get a good night's sleep. And you can watch that video and go through some of the symptoms yourself. And an abundant amount of people will come up with those symptoms. But it's actually very rare to have the disease called Addison's or adrenal insufficiency. And that's why I wanted to compare it to the difference between gluten intolerance, which is very common, and celiac disease, which is a rare extreme form of those symptoms, and an escalation of that into the disease realm. Let's go into what we have here today. So Addison's disease is also called, as I said, adrenal insufficiency. It's an uncommon disorder, so it doesn't happen a lot. That occurs when your body doesn't produce a certain amount of hormones. In Addison's disease, your adrenal glands, which I'll show you in the next picture, they're located just above your kidneys, produce too little of a needed hormone called cortisol, and often too little of another hormone called aldosterone. Just a little interesting aside of history is John F. Kennedy had Addison's disease. He kept it hidden. He wanted to be known as that young, robust, 40-something president back in that time. And so they didn't really confirm that until after his death. Physicians who treated JFK and examined his body after his death confirmed that the 35th president had Addison's disease. And, so that's just a little interesting side note. But here's the picture I promised. So you could see on this person, the kidneys are located. You have a left kidney, you have a right kidney, and they're located under the rib cage. They're in the posterior part of your back. So I always like to tell my patients, if you make two fists and put them behind your back, and then lift your fists as high as they can go, that's approximately where your kidneys would be. And another interesting note is, it's also approximately the size of what your kidney would be. So my fist, I have a big hand, my fist would be about the size of my kidney. Now let's say you're a petite person and you have a tiny little hand. Well, your fist will probably be approximately about the size of your kidney. And that just gives you a ballpark idea. Some of the next slides, or all the next slides, I got my source or info from the Mayo Clinic website, mayoclinic.com. And Mayo Clinic, if you're not from the United States or if you've never heard of them, is one of our biggest research, teaching, and medical hospitals here in the United States. And I really think their information is accurate. So a lot of times I refer to them to see how they explain things. So adrenal glands don't produce enough hormones. That's what Addison's is. You could see on top of the kidney in this photo is a little yellow cap, and that's your adrenal gland. So the adrenals sit on top of each kidney, and it's a gland. And when the adrenals don't produce enough hormones, that's the problem. Specifically, the adrenal glands produce the insufficient amount of the hormone cortisol, as I mentioned. Sometimes the second hormone that gets depleted in that condition is aldosterone. When the body's under stress, like all sorts of stresses, fighting an infection would be one of them, this deficiency of cortisol can result in a life-threatening Addisonian crisis. And one of the things you'll see immediately is a crash in blood pressure. Symptoms tend to be nonspecific, so it's very hard to diagnose this at times. They can include fatigue and nausea. So how many times have we all had fatigue and or nausea? It doesn't mean we jump to the incorrect conclusion that we just all of a sudden have Addison's disease. And like I said, it's very rare. Treatment involves taking hormones to replace those that are not produced by the adrenal gland. So if you ever do get this diagnosis, you would see a medical doctor, probably specifically an endocrinologist, and they would want to do some type of hormone replacement. To give you an idea, fewer than 200,000 cases per year in the United States, and that would definitely put it into a rare category. Here's the bad news. The treatment can help, but this condition can't be cured. I don't know the history of those facts. Maybe you've heard of one case ever that did reverse, but very often I think maybe they were misdiagnosed. So to get the diagnosis, you requires a full medical diagnosis. Lab tests or imaging are required, and when it's chronic, it can last for years or be lifelong. So like I said, it requires a medical diagnosis. Other symptoms would be like darkening of the skin and dizziness upon standing. And other than the darkening of the skin, every other symptom is something you could get from other conditions. And that's what makes it challenging for someone to come up with that diagnosis. People that have Addison's may experience pain in the abdomen. They can also get achy muscles. Again, common symptom, right? Whole body. Overall, you can have dehydration, dizziness, fainting, fatigue, lightheadedness, loss of appetite, low blood pressure, low blood sugar, water electrolyte imbalance, sometimes excessive sweating. In your gastrointestinal tract, like I said, you could have nausea or vomiting. And also common with this could be for females, they could have absence of a menstrual cycle. Both men and women might crave salty foods. As I mentioned, there's a darkening of the pigmentation of the skin, excess urination, muscle weakness, reduced libido or sex drive, and weight loss. The treatment usually consists, when you get this medical diagnosis and you're working with your medical doctor or endocrinologist, they are going to advise a hormone replacement type of therapy. And like I said, the doctors that you would go to would most likely, at least here in this country, you would start off with your primary care provider, and they start to get suspicious and they send you for further testing, and finally you would get that diagnosis, and you would most likely, like I said, in this country, I don't know the protocols and procedures in other countries, but in the United States, they would have you pretty soon thereafter be under the care or under the umbrella of an endocrinologist that works specifically with metabolic and other hormone disorders. So that's just a little bit. I do work with the lesser of the two, so I don't take on, or over the years I have not worked with patients with Addison's. If someone did have Addison's, I referred them to work directly with an endocrinologist. But like I said, I think tens of thousands of people here in the United States do have adrenal fatigue, which are milder, similar symptoms of Addison's that can be worked on through diet, through supplementation, and bringing attention to how they can have a multifaceted approach to helping that chronic overwhelm or chronic fatigue, and adrenal fatigue specifically. If you want to stay in touch with me, please subscribe to this channel. I also have a big chiropractic presence with behind the scenes chiropractic adjustments, both on YouTube and Instagram. And I do make my own nutritional supplements that I'm proud of, because over 20 years of clinical experience, I started to come up with formulas that help my specific patients here. And I am now sharing them online. So if you ever want to check that out, the site is called Little Tree Nutritionals. I also have that in the description below. Thanks for checking this out today, and please leave a comment or a question if I can help you. Thanks.